So we'll be discussing about malaria prophylaxis in pregnancy. It's also another high topic ahead of Mdcn exam. So this counseling, we are doing counseling. It's a
Okay.
counseling topic. Counseling, counseling on malaria and prophylaxis in pregnancy. So it's a very high topic you need to do. So for your counseling, we know our acronyms, GADA. As I always say, if you are just watching this video for the first time, you need to watch Introduction to Counseling. We've done it before. So you understand the G, the A. I'm not going to be going through the G and the A. But please don't forget, since this is a gynecological counseling, it's very important you ask about the reproductive profile. And you want to ask about symptoms of malaria also. Quick reproductive profile, like the reproductive profile, and a few symptoms, like the patient be experiencing fever, fatigue, headache, and all the rest, before you continue. And for your reproductive profile, you want to ask about the LMP, the EDD, the EGA. So these are important points you need to ask. Okay, before you
Yes.
start asking the patient, does she know anything about malaria and prophylaxis or malaria? Before you now move to your tail. So your tell is where you say everything you know about malaria. So you start with definition. Let's just say definition. So malaria, how to define it? Malaria is an infestation. So anytime you have parasites, mostly parasitic infestation, please take note. So parasitic or malaria is an infestation caused by a plasmodium species. Plasmodium species, and is spread by what? Is spread by what, doctor? What is this? What is this spread by?
Malaria is
Mosquito.
spread by
Mosquito.
plasmodium. Mosquito, yeah.
Yeah, spread by mosquito. Please take note. Okay. So malaria is an infestation caused by plasmodium species and is spread by mosquitoes. So we want to explain the types, the classification, the types. So we have I want to tell the mother we have the falciparum, the plasmodium falciparum. Falciparum. The falciparum is actually the deadliest of all in this environment. Are you getting me? It's the deadliest
Yes.
of all. It's very dangerous. It's not so good. We have the vivax. We have the ovale. We have the malaria. And we have the nolese. Okay, so these
Yes.
are the classification you want to explain to the patient. So after explaining this, you probably also want to talk about the means of contact. How do people get malaria? So let's say means of contact. Let's say contact of malaria. The major means of contact is what? Mosquito bite. Please take note, doctor. Mosquito bite. Now, apart from mosquito bite, you can get it through blood transfusion. So maybe a blood that is infected with malarial parasite, you can actually get it if not well examined. So blood transfusion. Okay. And apart from blood transfusion, it can be gotten through like things like organ transplants. So also through organ transplant, you can get it. And maybe from mother to child. Very important. Congenital malaria. Because don't forget we are doing malaria and prophylaxis in pregnancy. So mother to child also can result to congenital malaria. So these are means by which malaria can be spread. So haven't you explained the means? It's also very important to also explain the symptoms. If somebody have malaria, what should be the presentation? Are you getting me? So
Yes.
presentation or clinical features. You know, there are different types of this. There is severe and the one that are not severe and complicated. We're not going to discuss about that. We're just going to talk about the general symptoms here. Are you getting me?
Yes.
So an Mdcn question, they may also ask you, maybe in MCQs, or the other thing is you should be able to know the criteria for severe malaria. You understand? We'll discuss about that later. But here you
Okay.
just have to mention the general clinical features. So general clinical features would include things like what? Fever,
Fever, headache,
chills,
chills,
chills, and rigor.
pain.
Yeah, headache could also be there. Headache.
The patient might lose appetite.
Yeah, loss of appetite. Loss of appetite. What else? When we lose nausea and vomiting. Don't forget.
Yeah.
Nausea and vomiting. Even sometimes it can come with constipations, diarrhea. It can come with constipation or diarrhea or and diarrhea. Anyone. You understand? Malaria can be very, very vague. And apart from that, it can have things like all these lethargy.
Yeah.
Lethargy, the patient may have all this malaise, muscle ache, etc. Okay, so some of the symptoms the patient will be experiencing. So you have to explain this when you are counseling. Okay, haven't you explained this? You want to explain the complications. The complications. This is actually the major. This is one of the major aspects you need to also talk before talking about prophylaxis in general. What are the complications? Complications. So there's complications to the child and to the mother. So let's start to the mother. To the mother. There's an acronym for it. Doctor, do you remember the acronym? SHAME. That's the name of the acronym. You understand? SHAME.
Yeah. Shame.
SHAME. Yeah. So that's the acronyms for it. So for the SHAME, the S means what?
Spontaneous
Spontaneous.
abortion.
Yes. Spontaneous abortion. So if the woman don't do proper prophylaxis, she's prone to have spontaneous abortion. So the H means what?
Hypoglycemia. Glycemia.
Hypoglycemia. Okay. The A means what?
Anemia.
Anemia. Okay. The M means what?
Maternal mortality.
Yeah. Maternal mortality. And we have the E, which is edema in the lung. So edema, lung edema of the lung. You understand? So this is the complications to the mother. And there could also be complications to the child or to the baby. So complications to baby might include things like what? Intrauterine growth retardation or intrauterine fetal death. Intrauterine fetal death. Do you understand? It can cause growth retardation. It could cause death of the fetus. You understand? It can even cause prematurity or congenital malaria. Prematurity, congenital malaria. I get me, doctor. Please take note.
Yes.
These are some of the complications we need to take note of. Do you understand, doctor? So the next part is investigation. Investigation. So let's talk about the investigation. So peradventure, this person is having malaria. What are the investigation you will do? So basically, there are two types of investigation. There is a thick blood film and there is a thin blood film. Okay, there are other investigations though. We're not going to go into all those other ones using your acridine and orange, all those things. No, the basic thing you just want to explain is as simple as you can and move very fast. You really don't have enough time. So you want to explain the investigation. Investigation. What are the things you want to do under the investigations? So the first thing is you want to do your blood film. Blood film is the major thing. So it's more of a microscopic investigation. Microscopic investigation. So you use your microscope. So we have two types of it. We have the thick and the thin blood film. So what's the difference between both of them? Where do we use thick? Where do you use thin? The thick,
So we use the tick to check the parasite load.
very good. So thick blood film is used to check what? To check
Parasite load.
parasite load. Please take note. It's used to check the parasite load in the blood. That's where you use the thick blood film. Why the thin blood film? Which situation do
It's
you
used
use
to
the
check
thin
the
blood
species.
film? Hmm?
It's used to check the species.
Yes, this is used to check the specific species of the parasite. So for you to check the specific species, this is used for the specific species. Maybe you want to check for Plasmodium falciparum to check the specific species of malaria. You understand? That's when you use the thick blood film. Please take note.
Yes.
Use your thick blood film. Okay? So these are the investigation. So peradventure you realize this woman have malaria, you actually treat. We're not going to talk about the treatment now. So now over to the main order of the day, which is the prophylaxis. Please, I want us to pay maximum attention here. Prophylaxis. So for the prophylaxis, let me use different color. Let's talk about the prophylaxis. So for the prophylaxis, prophylaxis. So what do I mean by prophylaxis? So there's a specific drug we use for prophylaxis of malaria, and the name of this drug is your fancida. Please take note, fancida. But please, during the exam, don't call it fancida. Call the full name. It refers to as sulfadoxine pyrimethamine. You understand?
Yes.
So sulfadoxine pyrimethamine. Okay, this is the name of the drug that they use for malaria prophylaxis in Nigeria. And you need to explain to the patient when they give this drug, how they give this drug. Are you getting what I'm saying?
Yes.
So the major thing is, how do you give the drug? How do you give this sulfadoxine pyrimethamine? You need to know how they give it. So actually, this drug is given immediately after quickening. And quickening is when the patient feels the fetal kick. You start the drug that time. So that is approximately around 16-week gestation. Okay. So let's say the first, there are 3 tablets. And don't forget, this drug is given DOT. What do I mean by DOT? Directly observed therapy. So the patient comes to the hospital in front of the doctor. The patient swallows the pills. Are you getting me? That is DOT, directly observed therapy. So that is when they give the drug. So it's given after quickening or after the first fetal kick. So you want to confirm if the mother has failed the fetal kick. So this is quickening. Okay. So that is when you start giving sulfadoxine pyrimethamine. So approximately around 16 to 20 weeks, within 16 to 20 week gestation. Please take note. So at the first time, and don't forget, I said it's giving what? It's giving DOT. So it's taken in the hospital. Directly observe therapy. So the patient comes to the hospital, just like when they are giving you TB drugs, the same way. So it's giving duty. So how do you give this drug? How do you give? It's just like 3 tablets. So the 3 tablets is given twice for a healthy patient. For a normal healthy patient, is given twice. So at the first time the person fed the fetal cake, which is approximately 16 weeks, and after 4 weeks again, which is like 20 weeks, the patient will come back and take the other tablet, the other 3 tablets. That's for a healthy individual. So let's say 3 tablets, 3 tablets is given. 3 tablets is given twice. Is given twice. Do you understand? The first time is what? You give first. How am I going to write this? Let's say first. First, given at around 16 week. First fetal kick. Are you
Yes.
getting me?
Yes.
Comma. Then after 4 weeks, the patient will come back again for the second drug. So the second 3 drugs is given after 4 weeks. I don't know if you understand, doctor. Do you understand?
Yes.
Good. So the next thing is all this one is for LD patient. But if it is somebody who is maybe sickle cell, they might need to repeat this drug 4 times. So after the second 4 week interval, they come back again. You understand?
Yes.
So it will be like around maybe 20 weeks, 21, 22, 23, 24.
24.
Yeah, do you understand? So it will be
Yes.
3 times for maybe a sickle cell patient. This one is
Yes.
for healthy individual. All this one I'm explaining is for healthy individual. Please take note. This is very important for healthy individual. And for a sickle cell patient, for a sickle cell patient, um, for a sickle cell patient, for a sickle cell patient, this drug is given 3 times. So let's say for sickle cell is given for sickle cell patient is drug is given 3 times with 4 week interval. Please take note of this, doctor. Please, this is
Okay.
very important. Okay, this is
Yes.
for a sickle cell patient. Please don't forget when you're explaining to these patients, you have to tell the patient they have to stop the iron supplement the patient is taking when they are taking this drug. Are you getting me? So you
Okay.
stop all those hematinics so it doesn't, because there might be drug interaction here. So the patient
Okay.
have to stop the intake of these drugs. And please, very, very important, very, very important, is to explain conservative measure also. Conservative measure. So conservative measures of preventing malaria in the environment could be sleeping under well-treated mosquito nets. You want to encourage the mother sleeping under mosquito net, well-treated one. Or maybe you try to remove any stagnant water around. Let's say remove any stagnant water around. Use of, let's say, things like mosquito repellent cream
Mm-hmm.
or insecticide. Let's say use. Oh, what just happened just now?
What happened?
I don't know. I think I selected something. I undo. Let me redo it. Okay. Oh, it's back. So use of around. Let's say use of and mosquito cream. Mosquito cream. So these are cream they rub on the body and it repel mosquito. It's more like the repellent cream. And use of insecticide. Insecticides. So you spray the insecticide. So these are some of the conservative measures you need to also explain to the patient. Doctors, please, I believe you understand everything we're explaining here.
Yes.
So basically, um, these are the basic things you need to explain to the patient when you are counseling them for malaria prophylaxis in pregnancy. Very quick. Don't forget you do your normal introduction. You grade the examiner, you grade the patient. I understand you have a need for counseling regarding malaria prophylaxis in your child, and I hope I'll be of help to in you. I hope I'll be of help to you today. You like to tell her that is she okay with you speaking English, or she want translators to be here? Whatsoever we'll be discussing is really between both of you. Is she okay with the setting, or she wants somebody to be around? That's the basic stuff. Then you ask about a reproductive profile. When like this, your menstruation, the LMP, do you know your gestational age now? When do you know the time you are supposed to deliver this child? That's quick. Have you been experiencing symptoms like fever, malaria? You are done with those ones. Are you getting me? Then you
Yes.
go malaria. You start with the definition. Malaria. Malaria is an infestation caused by what? Plasmodium species. Is spread by mosquitoes. There are different types of this species of plasmodium. We have the Plasmodium falciparum. We have Plasmodium vivax, ovale, malaria, nulesi. How do you get malaria? You can get. So you just very in summary, you do this within 5 minutes. It's actually very easy. You understand, doctors?
Yes.
All right. So, in the absence of no question, that will be all regarding malaria prophylaxis in pregnancy. Okay.
All
All
right.
right, doctor. Thank you.
Thank you so much, Doc.
You're welcome.